Dear friends, I am happy to meet you once again this Saturday, 4th March 2023. We are happily finished and successfully treated 1071 cases of Puberphonia. It is the greatest achievement in the world. So we are so happy and excited to have so many number of Puberphonia patients are coming weekly. We are so much excited, and our research also goes beyond our expectation. Mainly, we want to prove the uvula is a major organ for speech in terms of articulation and making resonance in the adjoining structures. Now, the great thing we are going to give this month, our experience is we are doing MRI to visualize the uvula moment. We know this is a very costly affair, but few MRI centers are helping us doing it freely. So, what more we can in the world? We can achieve anything. Now, the new interesting subject for you is you are going to so far you are going to hear the sound. Now you are going to see the sound. You are going to see the sound by MRI. One sense is perceived in different organ. This is called synesthesia. I was very much fascinated with the theory of synesthesia. One interesting story I want to tell you. One boy's mother met with an accident. So she had some confusion in the brain. It may be due to the contusion. But she's happy, healthy, but admitted in the hospital. So the son, with so much excitement, he had come and visit the mother in the hospital. Oh, mother, what had happened? But she is not able to recognize by seeing that she is not yet able to identify by seeing whether this is my son or not because of the contusion in the brain. She says, "You're not my son. What happened to you? Why you are asking me, calling me as mother?" So with the great dissatisfaction and dejection, he went to the other room and find out a small phone. He phoned to the mother. "Oh, mommy, I had come." On hearing the sound, the mother immediately recognized, "Oh, my son, where you are now? I had an accident. Come and see me." So, when she is seeing, she is not able to appreciate the son, but while hearing in the phone, she recognized her son. Synesthesia. A cross wiring had happened in the brain. Lot of theories are there. Lot of experiment is there. Lot of new research were there. There is what we call as mirror neuron is the synesthesia is the birthplace for mirror neurons. Now we are going to see you from puberphonia. You are going to see the sound. sounds are created in the vocal tract. Now we are going to record the voice and where the articulation had happened. This had given an initiation for us to prove uvula is one of the major organ for speech production. Very nice thing. Happy. So this is a major breakthrough. We may do it. We hope so. So every day is exciting for us. What happened to the voice? You are going to see this. I know that more pets are having that synesthesia effect. They will tell, காதிலிருந்து தேன் பாயுது, சந்திரனை போன்ற முகம். These are all synesthesia. How a face can become a moon. How a good fluid can come from the ear by song. This may look like a prize, but these are all synesthesia effect. Somebody see the letter R, they will be excited. It may look like a red color, green, happy. So these are all synesthesia effect we are facing every day in our life. So now we are going to make a synesthesia. You are going to see with your vision the speech sound. Voice is almost VO, I see, oh, I see. That is the voice. VO, I see, VO, oh, I see, that's all. This is called voice. This is our pet research project. I hope I am more excited. The world also will take care what we are seeing, what we are doing, what we are inventing. This is not a research. This is our own research. So that is the basis. Now, I am in this month, my whole effort is for recording speech sound and articulation in MRI. So we can see the sound, see the vocal cord movement, and it will be platted in the paper, and where I can prove that uvula is a auxiliary organ of speech and major organ for treating puberphonia. That is what I want to tell the public and the medical fraternity. So we are going on recording the uvula in normal subject and in puberphonia and after treatment. Definitely, it is a very tough job because this is what a new, and we are in the field. We are the first person going to touch the uvula and in action. See what happened even for before 2 years itself. I have tabulated what had happened to the uvula in different sounds, whether the uvula is coming forward, backward, because I know very well uvula is making a knee shape when speech is produced at the level of velum. So there also somehow the research is going on. They are not giving importance to the uvula. They say back of the tongue, that area in the back of the tongue, along with the pharyngeal wall, more sounds are produced. That they call as velum. What area? Where within this velum area only the uvula moves and makes sound. It initiates sound in the nose. That is the main resonating mechanism where the eustachian tube always is there, where it can open the eustachian tube, tensor tympani, tensor palatine. So it can open and make the eustachian tube not like a ventilation tube to the middle ear, but it also make a whistling sound. When we swallow, everybody knows that eustachian tube open. But when we speak also in animals, this is a very big sac, eustachian tube. In horses, it is a very big sac. So this has a direct connection to the ear, inner ear, labyrinth, hearing organ, where the information is sent to the brain very quickly. This itself will prove us the frequency changes mostly happening in the vocal tract. Helmholtz in 1863 itself, Helmholtz's resonance theory of voice, acoustic theory of vowels, which is introduced by Helmholtz in 1863 itself, the quality of voice depends upon the resonance characteristics of vocal tract. Indirectly, it says the character is not due to vocal cord. So now, fundamentally, I am touching what is the organ for speech. We know it is a larynx, okay. But the main organs of speech is the main articulator. The main articulator or voice articulator or tongue, upper lip, lower lip, upper teeth, upper gum ridges. That is called alveolar ridges. Hard palate. Then they say the velum, subpalate. The uvula, the free hanging edge of the end of the soft palate, the pharyngeal wall, and the glottis, that means the space between the vocal cord. These are the 7 organs of speech. So, what are the organs for speech? It is a 7 organ. Because we know that very, very well. When we are born, we are not having speech at all. Respiration we got. By the end of 1 year only, the child will say Amma, Appa. So we utilize the respiratory organ for making the speech. So there are 7 organs for speech. See, this is teaching is only for thinkers, not for students. What are the 7 organs of speech? Nobody will ask. They will ask one question. What is the organ of speech? You will say larynx and vocal cord. No. So this is a very big controversial. We have to prove it, and I will prove it. That's all. The speech articulatory organs are upper lip, lower lip, upper tooth, upper gums, which is called as alveolar ridge, hard palate, soft palate, uvula, pharyngeal wall, and the space between the vocal cord. So this is the speech organ. What are the process of speech production? The process is the air stream from the lungs comes, It goes through the trachea, then it goes through the respiratory tract and goes to the mouth, above nose and sinuses. So it involves four processes: initiation at the lungs, phonation at the vocal cord, oronasal process with articulation. So now our main subject is MRI. MRI in puberphonia. The upper airway consists of several soft tissue structures and muscles. So they are all coordinated to perform the essential human function as speech, swallowing, or breathing. This MRI, that means magnetic resonance imaging, is in the upper airway, offers a non-invasive way of to visualize the morphological and functional aspect of the upper airway structure. Definitely, there are a lot of advantage over X-ray fluoroscopy study, ultrasound study, because MRI, magnetic resonance imaging, is so safe, and we can visualize the soft tissue structures like uvula, pharyngeal wall, and larynx. So without hurting the soft tissue, you can imagine that image will be created when we talk. So far I have tried with the X-ray, ultrasound, glossometry, palatography, video, fluoroscopy. So with so many dye, I have placed in the vocal tract and taken the X-rays, because you know that barium swallow is a simplest method by which we can study the inner digestive tract, even the pharynx, because barium meal coated we can take simply with the X-ray. Then we can follow with the endoscope. Now we had got a very good ornamentarium called as MRI, magnetic resonance imaging. In everybody will accept, it is not going to hurt the patient no more. So it is a powerful tract. It is a powerful tool in obtaining the orotracheal tract geometry, and does not involve any radiation risk. So that is the very, very fundamental answer we are getting. So very simple mechanism, we will get image of the vocal tract, and we can get it as, see, this different shape of the vocal tract in various sound. In foreign countries, I know that they can simultaneously record the voice also. But here in Chennai, my friends radiologists are telling sound recording is not possible, because this MRI operate by magnetic resonance. If a metal is placed in that place, it won't work. That is why when you go for taking MRI, they used to ask us to remove all the metal plate, paisa, coins, and jewelry. Even dress coated with some silver, it is not permissible because the MRI won't work. That's all. So this airway we are able to see, not only see the volume of air or the pressure can be calculated clearly in MRI. So we have done few cases recently. We got wonderful report. In Puberphonia boy, just vocal in the region of the uvula soft palate, the uvula hangs, it doesn't move powerfully. One of the doctor had seen the MRI of the uvula recorded by us, and he was so surprised. The uvula is moving for every words, this side, that side, above, down, vibration, dancing. So this even that doctor is excited. You are correct, sir. Yes. What is the fundamental difference between human being and animal? Animal is not having a speech. Human beings are having speech. Okay. The second difference is animal is not having uvula. Human beings are having uvula. So uvula is not a vestigial organ. God had produced only with a purpose. That is brought forward by our theory of uvula manipulation and its activity in producing resonance treat Puberphonia. What a great thing we are going to prove. So this will give a world recognition for our treatment among the ENT fraternity, because we are going to prove that uvula is a accessory organ of speech. Uvula is the main organ to treat Puberphonia. So we are going on recording the airway structures. Definitely we'll able to record the sound also. Still now in Chennai we are not able to record the sound along with the movement of the uvula in MRA. The greatest advantage when we did MRA in normal subject, they are not able to utter several times the same speech. But in our Puberphonia boy, we are having the advantage. They will talk only Puberphonia speech forever. So there is no question of repeating the same thing. So this is a great way for us and happy also. So with this MRI, now we are doing certain um, tests, male and female. So we are able to make a chart, phonetry chart. Already good international phonetry charts are available for vowels, but their main concentration in the oral cavity with tongue movement only, but they have not taken consideration much, or much work is not done on uvula. We Indians or Tamilians more interested in uvula word because we are having a word utilizing annak, uvula. So here, international phonetic graph mainly oriented in mouth cavity with movement of the tongue. But what we are very much interested is in the palatal plane. We utilize the palatal plane for assessing the function movement of the soft palate, including more concentration on the uvula. So palatal plane. So a new chart we want to develop. Definitely, God will be grateful to us because so we know this palatal plane is a very important plane which goes from the tip of the nose along the palate, the root of the uvula to the skull base. So this MRI room presents a challenging environment for sound recording. There are series of issues concerning acoustic noise interfere to electric from electromagnetic field in the MRI machine. So some metal components and electronics are restricted inside the MRI room. So which is completely excluded in the MRI room or in the MRI machine for the safety and image quality reasons. But we want to have microphone which should be attached with the uvula to record the sound. My friends are telling which is available in foreign countries including America. So my next moment should be we should go to a nice good MRI center in America and record the voice in different. Uh, that too, I want to do it in Tamil language because Tamil language everybody know in the world. Tamil is a old language, but it is a difficult language to learn because vowels itself A B C D okay. Here A E U, but A also too. A means one slow is there, needle also there. Ah. English is nothing like that. Hey, hey. Nothing like that. Similarly, consonant. So, Vallinam, Mellinam, Idainam. The three things are there. But it is very, very important. The anatomists are clearly described in Indian literature where it is produced from the chest, where it is produced from the neck, where it is produced from the head. Vallinam, Mellinam, Idayanam. Kasada Dabara, Ningana Namana, Yarala Valada. So these features, alphabet, so and consonant, so different character, God had given a great opportunity with MRI to utilize Tamil language for the identification of each sound and what is the articulation happens in MRI. Already there are a lot of study going on in computer. Tamil is the easiest language to put it in the computer. Similarly, I personally feel Tamil is the easiest language to put in MRI to know exactly what is the articulatory mechanism happening in each verse. So God had given us a great opportunity for this Saturday. So in future, by our work, it is not research, by our invention, you will be able to not hear sound, you will be able to see the sound. That is the wonder we are going to make. Thanking you, great for this Saturday. We'll try to meet next Saturday, but wait for a few minutes because already my friend had come for giving a small talk on Tamil. So he will now continue that after a break of 3 minutes. Thank you. Great. I'll see you next Saturday. Thank you. Great once again.